What is up, guys? Welcome back to Patho and Chill. Today we're going to be talking about a disease called pneumoconiosis. Now, this disease basically occurs when one inhales, normally in a work-related scenario, one inhales different particulates and basically stimulates a chronic inflammatory disease within your lungs, leading to fibrosis. Now, we're going to be talking about two main particulates, the first one being silica and then the second one being asbestos. So for silica, this is going to cause silicosis, and so silicosis is actually the most common of this type of these diseases. And it'll basically be found all around the lung. And then the main thing to know about this one is that it puts you at an increased risk of getting tuberculosis. Meanwhile, we move on to asbestos. So if we inhale asbestos, it'll also, like I said, lead to this chronic inflammatory reaction and lead to asbestosis. And so for this one, while it's not the most common, it is the most dangerous. And this one can be found all around the periphery of the lungs, whereas for silicosis, it was all around, within the lungs. And lastly, for this one, it basically puts you at an increased risk of lung cancer. So what exactly happens whenever you inhale this particulate? So as we breathe it in, it goes in via our trachea, it goes in through the bronchioles, and then reaches the alveoli. And so once it lodges into the mucosa of the alveoli, it stimulates an immune response. So we have basically alveolar macrophages in that lining mucosa that once they take up that particulate, they trigger the immune reaction. And so basically the macrophages start sending out cytokines to basically recruit other cells, so other white blood cells. And one of the types of cells that also is recruited is a fibroblast. So these fibroblasts arrive to the site and they start proliferating. And then this prolonged, and the reason why this is like a chronic thing is, and also work related, is because you keep going to work, right? So you basically keep inhaling this particulate. And so because you keep inhaling it, you're not letting your immune system rest, basically. And so these fibroblasts keep getting recruited, keep getting proliferated, and they start secreting collagen. And so basically this is going to start leading to scar formation. And this is why we get the fibrosis of the lungs. And as you may know, as we get the fibrosis of the lungs and all the scar tissue, the alveoli basically can't work as efficiently as they once used to, meaning they're not as elastic anymore. They can't recoil, they can't expand to basically allow more oxygen and more airflow into the alveoli that can then give oxygen to the blood, which will lead to further problems of perfusion of blood to other tissues in the body. And so anyways, this is a pretty short disease, not much to know about it, just basically that there's a chronic inflammatory reaction going on that leads to fibrosis, and then you can basically guess what other effects happen after that. But anyways, if you enjoyed this video, please make sure you hit the like button down below, subscribe, and go check out my other videos. That is basically all I have for you today. Make sure you stay chilling, and peace out.